I am Dr. Sumathi Jones. Today we will be discussing about Indian Drugs and Cosmetics Act 1940. The Indian Drugs and Cosmetics Act 1940 and its subsequent amendments is a cornerstone piece of legislation in India that regulates the import, manufacture, distribution and sale of drugs and cosmetics. Its significance lies in ensuring the safety, quality and efficacy of the drugs and cosmetics for public health. It includes various schedules that classify and detail provisions related to drugs, cosmetics and their regulation in India. These schedules provide the framework for quality control, standards and compliance under the Act. Key schedules are Schedule A to Schedule Z. Coming to Schedule A, it specifies forms and formats of applications, licenses and reports related to drug regulations. Schedule B, it lists the prescribed fees for the testing and analysis of drugs and cosmetics. Schedule C and C1, it covers the biological products such as vaccines, sera, toxins, antitoxins and other biologicals, their stringent storage and manufacturing requirements. C1 in particular lists the prescribed fees for the testing and analysis of drugs and cosmetics. Coming to Schedule D, it lists exemptions for certain drugs like imported drugs from specific provisions of the Act. It also includes information on required documentation for the import. Schedule E1, it includes substances used in Ayurvedic, Siddha and Unani medicines. Schedule F covers standards for vaccines, surgical dressings and umbilical tapes. Subschedules F1 and F2 provide specific standards for blood products, ophthalmic preparations, etc. Coming to Schedule G, it lists the drugs that need to display a statutory warning. Caution, it is dangerous to take this preparation except under medical supervision. Schedule H, it details the prescription-only drugs that cannot be sold without a registered medical practitioner's prescription. Coming to Schedule H1, it is a stricter subschedule for antibiotics and certain controlled substances to curb misuse. Schedule I encompasses controlled substances and narcotics. These drugs are subject to strict regulations due to their potential for abuse and addiction. Schedule J, it lists the diseases and ailments that cannot be claimed to be cured by drugs, that is cancer, AIDS or blindness. Schedule K, it specifies the drugs exempt from certain provisions of the Act such as labeling and license requirements for specific cases. Examples include homeopathic medicines. Schedule M lays down good manufacturing practices GMP for pharmaceuticals, including the requirements for facilities, equipment and hygiene. Further, subclassification Schedule M1 covers the GMP for homeopathic medicines. Schedule N specifies requirements for pharmacies, including their location, equipment and personnel. Coming to Schedule O, its standards for disinfectants and antiseptics. Coming to Schedule P, it specifies the life period of drugs, that is shelf life. Schedule P1 covers the exemption for labeling requirements. Schedule Q, it lists permissible colors for drugs and cosmetics. Schedule R, it states the standards for mechanical contraceptives like condoms. Schedule S specifies the standards for cosmetics. Schedule T, it details the GMP requirement for Ayurvedic, Siddha and Unani medicines. Schedule U, it prescribes the requirements for maintenance of records by drug manufacturers. Schedule V stands for patent or proprietary medicines. Schedule X includes narcotics and psychotropic substances that require strict control over sales and distribution. Coming to Schedule H in detail, Schedule H drugs are category of drugs in India that are prescription drugs regulated under the Drugs and Cosmetics Act 1940. It requires a prescription from a registered medical practitioner for purchase and use. It is indicated for treating conditions that require medical supervision due to potential side effects, misuse or habit-forming properties. So, the common drugs under this category are antibiotics, that includes amoxicillin, ciprofloxacin and so on, antidepressants, sertraline, amitriptyline and so on, antipsychotics, risperidone, haloperidol are the examples. Coming to antihypertensives, amlodipine, atenolol are the examples. Anti-diabetic medications like metformin and glimepiride are also included in this category. Coming to anti-inflammatory drugs, diclofenac, ibuprofen in specific formulations are included in this group, and anti-cancer drugs like cyclophosphamide, methotrexate are also included in this category. So, in general, Schedule H drugs requires prescription. It cannot be sold without a valid prescription from a licensed doctor. The sale of these drugs must be recorded by the pharmacy, including the details like the name of the prescriber and the patient. The labeling, it should carry a mandatory warning label that reads Schedule H drug, warning, to be sold by retail on the prescription of a registered medical practitioner only. Some Schedule H drugs may also fall under the Schedule H1 or X for strict control, such as habit-forming substances or narcotics. Non-compliance, such as selling these drugs without a prescription, is a punishable offence. Coming to Schedule Z, it relates to clinical trials focusing on standards and protocols for drug evaluation. Schedule Z. Schedule Z drugs relates to clinical trials focusing on standards and protocols for drug evaluation. Coming to revisions, schedules are updated periodically to reflect new drugs and regulatory requirements. Each schedule serves to ensure the safety, efficacy and quality of drugs in India. Coming to the significance of these schedules, standardization, it ensures the consistency in quality, safety and efficacy of the drugs and cosmetics. Regulation, it provides clear guidelines for manufacturers, importers and sellers to comply with the legal requirements. Consumer safety, it protects the public from unsafe or substandard products through stringent controls. Ethical practices, it prevents the misuse of drugs and false claim for certain diseases. Global alignment, some schedules align with international regulatory practices promoting global competitiveness. I hope you had a clear understanding of Indian Drugs and Cosmetic Act 1940. It is important to learn and understand the schedules of this act for good medical practices. Thank you.